Hi, so welcome to the Willows Health series of webinars on child health. So many of you may have joined us for our last webinar on childhood fever before Christmas, and that was hosted by myself, Professor Rowland and Professor Rizvi. So we actually had some fantastic feedback from that webinar, and as a front to that webinar, we're sort of choosing to talk about childhood wheeze, cough, and chest problems, and something that's some problems that we quite commonly see in general practice and in the hospital A&E department. The aim of this webinar really is for parents and guardians to help improve their understanding of how and why a child becomes unwell, and really reinforce the idea that lots of these symptoms are part of normal childhood illness. We'll be talking more specifically about coughs, colds, and wheezes today. If you have any questions to pose to us during the course of this webinar, then please post it on the chat and we'll try and answer that if it's not answered within the content of the webinar. We're hoping that this is a useful episode for you, and we're hoping it's going to last no more than half an hour, but if you've got plenty of questions, we'll stay on for a little bit longer. That's not a problem. Will also be really useful to hear what type of topics you will want us to present during our next webinar, and because this is really to empower and educate the patients of Leicester and Leicestershire, and also the parents and guardians of Leicester and Leicestershire. Now, it's really important as medical professionals that we sort of give you medical advice and that you're able to access medical advice at the right time, right person in right place. And that, you know, in summary, is really one of the aims of this webinar. Important to note, though, it doesn't completely replace individual medical advice. And if you have concerns about your child, then we would always recommend seeking advice according to some of the information that we give later today. Just a few house rules before we continue. This webinar is being recorded. The plan is for it to be made available on YouTube later. There is a feedback form which is going to be posted on the chat a bit later, so it would be really grateful if you could complete that feedback, because that tells us how we are sort of doing in this webinar and whether this information is truly useful to you. We also hope to post some resources to you. If they're not posted on the chat, we'll try and email them to you. Dr. Damien, Professor Rowland, I should add. So Professor Rowland has, I should congratulate Professor Rowland actually, from Dr. Rowland to Professor Damien Rowland. We've got a plethora of medical expertise with us today with Prof. Rowland and Dr. Hannah Robbins, and I'm going to introduce the panel very shortly. Got to go back to the resources. There's a Bolo resource by Bernardos, which is really, really useful. And that includes a telephone number that parents and guardians can ring if their children are thought to have a chest infection or what we call respiratory symptoms. And so we'll post that onto the chat later. And if it's not posted, we'll certainly email that out to you. Professor Rowland has also developed a self-help leaflet or booklet aimed at the parents and guardians of Leicester and Leicestershire. Really, really useful leaflet, actually. And I would encourage all of you to read this. And again, we'll try and post that today. If we can't find it today, and if it's not on the chat, we will email it to you. So without further ado, I'm just going to introduce the panel, as it were. So I'm going to be asking the questions and your questions today. My name is Dr. Tariq Kapasi. I'm a general practitioner by trade. Also do a fair bit of research to try and help improve the lives of our patients in the future. And so we have Professor Rowland, who's a consultant in pediatric emergency medicine. You'll see Professor Rowland's name all over the media nationally these days because he's such a fantastic speaker. We've also got Dr. Hannah Robbins, who's a GP principal, and she's also a lead for child and young people's health within the Leicester, Leicestershire and Rutland CCGs. So thank you very much to our panelists for attending, and thank you to our audience for attending today's webinar. So I'm very shortly just going to go to Professor Rowland. So just tell us a little bit about coughs, colds, and sort of chest sort of illnesses that we see in children in this part of the season, because it's the winter virus season. Lots of people are catching coughs and colds. What are we seeing, Professor Rowland?
Yeah, thank you very much for the invite. So I think what's worth defining is what we mean by coughs and colds. That is actually more complicated than you think it might be. A cough, something you cough. Everyone knows what a cough is. Everyone knows what a cold is. But from a medical standpoint, we actually divide the body up into two parts. We have the upper respiratory tract. So essentially, that's everything that's above the lungs, and the lower respiratory tract, that's everything in the lungs. And the reason that's important is the majority of illness in children is in the upper respiratory tract. That is your nose, your mouth, your ears, essentially everything above the lungs. And when we talk about kind of colds, we're talking about the upper respiratory tract infections. So you've got a bit of a runny nose, you might have a sore throat, your ears are a bit bunged up, and that's hugely common. And both children and adults suffer from that, but children in particular, there's a variety of viruses that give you upper respiratory tract infections and colds. You can also have kind of infections within your chest, which can give you a cough, and make you feel unwell. And we're slightly sometimes a bit more worried about lower respiratory tract infections because they can be more serious. But one of the challenges that we have in particular for children is that upper respiratory tract infections that make you have a bit of secretions or a bit of kind of a runny nose. In children, that often triggers a cough. Some of those secretions go onto your chest and makes you cough. So children cough a lot because they have upper respiratory tract infections, but it doesn't necessarily mean that they've got anything seriously wrong with their lungs. And that's a real challenge for parents because they get worried about their child coughing when sometimes it's just the nature of illness. And after a couple of days, that's going to go away.
That's great, Professor Rowland. I think that's really clear to understand. So separating the upper respiratory tract, and that's the vast majority of illness that we see in children, and the vast majority of which doesn't require any treatment. And then you've got the lower respiratory tract, and even in this case, it doesn't always require treatment, but occasionally these are the children which may require some level of treatment, perhaps. And you can sort of clarify that a bit later for our parents and guardians who have attended here today. Now, what are you seeing in A&E at the moment? And are the presentations that you're seeing in A&E, Professor Rowland, appropriate?
Yeah, so I think there's two interesting messages here. So one is it's the winter. So let's count the winter between September and the end of February. In the winter, when people get together, viruses spread. So we see colds, sore throats, little coughs, and that's normal. And you see that in your GP practice, and we see that in the emergency department, because those symptoms sometimes come with a fever. They sometimes make a child not feed very well. And so we see a variety of concern that is caused by upper respiratory tract infections, probably not because of the cold or the cough itself, but because it's making the child look unwell, or they've got a temperature, or that they've gone off their feeds. And I try not to use the word appropriate or not. The parent has a fear and they pitch up wherever they'd like to see help. But certainly, and I've been quite careful with my wording here, because one of the things that the leaflet that you mentioned earlier that we try to promote is to try and differentiate being concerned about a symptom and the actual appearance of your child. So the message that I constantly give in every workshop is that we are inundated by lots of parents who are worried about the cough. They're worried about the fever. They're worried about the diarrhea or vomiting. And what I would prefer that the lens through which the parents are looking at illness to be is, I'm actually worried about my child. My child doesn't seem so well. And that's important, especially in the winter, because in the winter, it's more likely that you're going to have a cough or a cold or a fever. But you don't need to be worried about that. Those are very normal, and they're the result of your child being unwell. What I'm more interested in is whether your child is drinking enough, whether their level of activity is normal, and whether they're sleeping in the right way. And so what we're seeing in the emergency department is large amounts of children with very simple coughs, colds and fevers. And they are all things that can probably be managed at home.
That's really useful, Professor Rowland, just to hear about the lens by which we should be viewing illness in children. And you're quite right, as a GP, the main concern is a symptom that the parents are concerned about rather than how the child is necessarily. And often when I'm doing my telephone consultations, which does allow me to see more patients overall, I'm able to establish as to whether the child's eating, drinking, playing, weeing, and the really key signs for me. But often, parents just require some reassurance. And we're going to talk about what services are available away from GP surgeries and A&E departments as to where parents can get that reassurance in a more appropriate sort of way. So I'm going to just come into the types of childhood illness here, Professor Rowland. I know there's been a few things in the news recently, particularly about bronchiolitis. It's a big medical word. Could you break it down for us? What does this mean? Is this something that we ought to get worried about? I mean, we see lots of it as GPs. We tend not to be so worried about it, except in very few circumstances. Professor Rowland, about bronchiolitis.
Okay, so bronchiolitis is a funny term, and where it comes from is in your lungs. You have things called bronchioles. They're little bags, essentially, that inflate with air when you breathe in and deflate with air when you breathe out, and that's how we get oxygen from the air. And bronchiolitis, itis just means inflammation, so it's inflammation of your bronchioles. Now, bronchiolitis is a very common winter infection that you might hear doctors talk about RSV. That stands for respiratory syncytial virus. You certainly don't need to remember that. But the virus causes this condition called bronchiolitis. It occurs every winter, predominantly in children between the age of 0 and 1. And typically what happens is that it starts in the upper respiratory tract. It starts in the upper respiratory tract, so you get a bit of a runny nose, might have a bit of a mild fever, then you will start with a bit of cough. The parent may notice the child breathing a little faster, kind of air going in and out quicker, and they sometimes might notice something called recession, the skin being sucked into the rib cage. That might last for a couple of days, and during that time the child might not feed as much, and they might just be a bit more miserable and annoyed with life, and then it will go away. In around 90% of infants between 0 and 1 with bronchiolitis, the condition is completely self-limiting, requires no treatment, and it is simply a minor cough and a cold, reduced feeding, and then you will get better. In about 10% of cases, that child will have so much breathing difficulty that it will reduce the feeding enough for the parent to get concerned, and they may well visit a general practice or an emergency department. And in 1% of cases, that breathing difficulty is so severe that we need to admit the child to hospital. And I just want to emphasize that those figures, they are the huge majority of children with this condition called bronchiolitis will get better. And I emphasize that point because last year we didn't see any bronchiolitis because no one was mixing so that the virus wasn't transmitted. And this year there's been lots of media reports about this bronchiolitis virus. And it's sometimes presented in a way that as if this is a new virus, or it's a severe virus, or it's a virus that can cause children harm. There is nothing different about the bronchiolitis this year than the 2 years ago or 3 years ago. And so I just want to emphasize, if you go and see your GP or you're worried your child might have bronchiolitis, again, what the important thing is your child's feeding and how they're responding. The vast majority of children, well over 90%, will just get better in a couple of days.
That's great. Thanks, Professor Rowland. You've answered so many questions that parents may have about bronchiolitis. And And the key points there really are 9 out of 10 children will get better, and they don't actually require any further assessment or treatment. There are some signs that you've actually told us about which should prompt medical assessment. And there are lots of viruses which cause this, and one of these viruses is the RSV. So thanks very much for that. The other thing that we see is a viral wheeze. So often you will have a toddler who has a runny nose and they develop a viral wheeze. And some of the questions parents may have around that is this an indication of asthma? And how should something like this be treated? Professor Rowland again, please.
Yeah, so in bronchiolitis, I talked about the bronchioles, those little bags of air. In order for the air to get to those little bags, they come down tubes, and those tubes can sometimes be narrowed by maybe a bit of inflammation or infection or just a response to a virus. And viral wheeze is simply what happens when those airways going to your bronchioles become small. Now, when you breathe in, because your lungs are so efficient, if they're a little bit narrow, it's easy to breathe in. They can be really, really narrow before causing you any harm. But as you breathe out, the pressure's different. So it's much more difficult to breathe out if your airways are narrow. And that narrowing creates this characteristic wheeze sound. And we term this viral wheeze because a virus is causing inflammation of these little tubes, making it more difficult to breathe out, and you become wheezy. And it's immensely common. There's lots of kind of viruses that can cause this. And what we think is that there are some children who, because of their genetics, essentially because of their parents, are more susceptible to this happening. So you could have the same 2 children who are both 18 months old and give them the same virus, but one child might become wheezy when the other one doesn't. And if you kind of talk to parents, often they'll say, well, when I was young, I was wheezy and then I grew out of it. And lots of children do grow out of this and they get better again. And there's a bit of confusion sometimes because we're a bit fixed thinking in the medical profession. And so asthma is, we like to label that as a chronic disease. If you've got asthma, you've got it forever. Whereas if you're an infant and you have viral wheeze, and viral wheeze is very similar to asthma, we don't like labeling you as asthma because so many children with viral wheeze just get better by the age of 5. There are a group of children with viral wheeze who go on to get asthma, but we don't call it asthma until essentially you're over the age of 5, because then we kind of know that you're going to have that for a while. Viral wheeze in itself, actually, if your child is just a little wheezy, but they're able to run around and they're eating and drinking, it's likely they'll have it for a couple of days, a bit like bronchiolitis. They'll have a bit of a cough, maybe a bit of breathing difficulty, and then they will get better. Unlike bronchiolitis, and this is an important thing, there are a group of children who do need inhalers when they're wheezy, when they're so short of breath they just can't do normal activity, and the inhalers will help viral wheeze get better. Bronchiolitis, because it's at the end of the airways and the bronchioles are full of mucus, inhalers don't help. And I make this point because sometimes we see families who have very little children, i.e. less than 6 months old, who sound like they're wheezy, and these poor parents have a sibling who's been an older wheezer, and they start giving these little babies inhalers. That will not work. Bronchiolitis and viral wheeze are different conditions. And so we save the blue inhalers, salbutamol, for viral wheezes. It has no effect on bronchiolitis.
Thanks, Professor Rowland. Really useful to hear your perspective on viral wheeze, and that in most circumstances, when children develop a bit of a virus, they can wheeze with it, and they tend to sort of not have asthma afterwards. So except for those sort of kids who do actually have asthmatic tendencies, which we'll find later on in life. The final condition that parents and guardians will want to know a bit about, and I don't think we need to talk at length about it, is croup. So can you tell us a little bit about croup, Professor Rowland?
Yeah, so croups a funny condition because croups are one of those things that actually is pretty well recognised both families and the medical profession. And croup is a condition where, unlike I've just talked about bronchiolitis and viral wheeze being of the lower airways, croup is really of the upper airways, and it's essentially a narrowing of the airway in your neck. And because of that narrowing, you make a very characteristic, some people talk about a seal or kind of a barking dog, and you have a very raspy way to the way you breathe. And it's a very simple virus that does this. And again, it's really interesting is that some children, you could have the same kind of child of the same size. One child gets a virus, doesn't get croup, the other one does. And we're not quite sure why that happens. But it's certainly there are families who have lots of children with croup or children or the croup is recurrent. And actually, if you've got the noisy cough, but you're otherwise okay and you're able to eat and drink and running around, you don't need any treatment. It will last for 24, 48 hours and will go away. About 30 to 40 years ago, the recommended treatment was to sit with your parents in the shower because it was felt that the humidified air of the shower made you feel better. We think that's probably not the case now, and the reason why that worked is because the parent was calming the child down by being in the shower with them. And certainly if I see a child present with croup who's really having difficulty breathing, the first thing I'm doing is not giving any treatment. It's really trying to calm the family down, because croup is one of those conditions where actually if the child is calmer, it does help the breathing. Croup though, if you've got a child who has this funny sounding cough, and they're making a very noisy when they're breathing, and you think that they're difficulty walking around, or they're certainly not eating and drinking, that is a child who I think does need medical review. Doesn't necessarily need to come to the emergency department. Probably can be reviewed by kind of GP colleagues like yourself. But there is croup. I think if you've never heard it before, and I mentioned kind of a seal or kind of a barking dog-like cough. Once you've heard it, you'll never forget it.
Thank you very much, Professor Rowland, for your expert perspective, and you've covered quite a bit actually. We've covered what constitutes normal childhood illness. We've talked about bronchiolitis, viral wheeze, croup. We've also talked about looking at children through a lens of looking at a child holistically rather than focusing in on the symptom. And I'm next going to introduce our next speaker, who's Dr. Hannah Robbins. She is the LNRCCG's lead for children and young people. And I can see we've got a screen share which is ready for the services that we could direct people to. But before I go to that, I'm just going to ask Dr. Robbins, what are you seeing in general practice at the moment?
Thank you, Dr. Capazzi, and it's a real pleasure to be here speaking to our parents this evening. Before Christmas, as GPs, we did see quite a lot of young children and babies with the bronchiolitis that Professor Rowland was speaking about a few moments ago. We're seeing less of this now. Quite often we do see bronchiolitis into March, but we're seeing more simple coughs and colds at the moment. But nonetheless, as a parent, it can be difficult to know what to do, even if your child does have a simple cough or a cold. And I think some of the noises that you hear from your child can be concerning. And as Professor Rowland says, quite often a cough comes with a cold and it can be hard to know what to do. And this is most of what we're seeing in clinic at the moment. These are usually caused by viruses. So what we see is that these illnesses usually settle within about 10 to 14 days. They don't need any treatment. Sometimes these children do need to be seen by someone at your GP surgery, even if that's just to lay eyes on them, have a listen to the chest and provide some reassurance. And a lot of that will depend on your experience as a parent, and it's really important to trust your instinct. And if you're worried, give your GP surgery a call, And we can either arrange a phone appointment or a video appointment, or if we need to, we'll see your child down at the surgery. Occasionally, what we see is these coughs and colds linger for a bit longer, and sometimes in the second week of illness, the child sort of takes a turn for the worse. Now that's unusual, but if your child does take a turn for the worse about 7 days in, that can be a sign that a secondary infection has taken hold. It can be a sign that antibiotics are needed. So we'd always say in the course of these illnesses, if things suddenly change and your child seems a lot less well, then definitely you need to be getting on the phone to your GP surgery at that point. And if your GP surgery is shut, then usually the first port of call would be NHS 111.
That's great, Dr. Robbins. Really useful to hear. Now, you know, we're seeing lots and lots and lots of patients in general practice, and we also have provision to see children if they're sick, but sometimes there's just not enough capacity in general practice to see all the children that you need to see. And sometimes our receptionists will redirect parents to different sort of agencies or providers of healthcare. Can you tell us a little bit about who those providers may be, Dr. Robbins?
Thanks, Dr. Kapazi. You're absolutely right. There are times when we need to signpost patients to other services. One of the services we're using a lot is called the pharmacy referral scheme. Now, this will be for slightly older children, and there's very strict criteria that our reception team follow to decide whether it's safe and appropriate for your child to be seen at a community pharmacy. But very often that will be the first place to get advice from. And there's even a system now where our reception team can actually book you an appointment with the pharmacist to be seen. There's also overflow facility, particularly across the city. So there's additional hubs where your child might be seen if there's no appointments left at your GP surgery. And again, your GP surgery reception team will arrange that for you and tell you where to go. There may be circumstances where you phone up and actually your child sounds very unwell, and it may be that it's more appropriate to direct you and your child to a more acute setting where they can be seen very quickly. It would be unusual, but very occasionally you may be asked to take your child to A&E, and that may be either by the surgery reception team, or it may be by a doctor, a nurse, or another healthcare professional that you speak to at the surgery. But usually, if your child needs to be seen, we will be able to accommodate that within general practice if you're concerned.
Thank you, Dr. Robbins. As a parent myself, you know, it can be really sort of worrying whenever children become unwell, even if it's a simple symptom. Now, often what I see parents come in for is simply reassurance, and you've signposted as to where parents can go to for that reassurance, and hopefully some of the resources that on the chat will help parents understand and empower parents how to manage these simple symptoms that don't even need to come to a GP surgery or a pharmacist. But of course, if you are still concerned through the symptoms that Professor Rowland and Dr. Robbins have talked about, then that would be the time to then contact your GP surgery. Now, what I just wanted to talk about, Dr. Robbins, now is how do we manage simple childhood respiratory illness? And when I say, you know, when your child gets a cough or a cold, what are the best strategies to manage that? Do they need anything over the counter, or should illness just run its course? So let's just give you a typical case. So, you know, a 4-year-old snotty child comes back from school, they've got a little bit of a cough. What should we be doing to try and manage that situation?
That's a really good question, Dr. Kapazi, and I'm also a parent and I understand some of the anxieties that we can all feel if our child is poorly. And it's often on the background of that child having kept you up overnight with their cough, and it's really hard to make sound decisions when you haven't had enough sleep as well as a parent. If your child is well and happy in themselves, there's really nothing that you need to do. Coughs and colds are a normal part of growing up. It's almost a rite of passage, and children need to go through these illnesses. It helps to stimulate their immune system, so that's our body's system for fighting infections, and it prepares your child for the future. And it means when they come into contact with similar infections in the future, they'll be better able to fight them off. So a cough and a cold really doesn't need treatments as it is. If your child is feeling miserable and grouchy with it, there may be a place for things like paracetamol and ibuprofen, which you can buy over the counter from any supermarket or from the community pharmacy. And if you've got young children in the house, it's a really good idea to keep some paracetamol and ibuprofen somewhere in a high cupboard in the kitchen where they can't get their hands on it, but you can get your hands on it if your child needs it. And there really isn't a lot else we need to do for simple coughs and colds. It's a case of waiting for it to run its course, just giving your child the cuddles when they need them and when they're feeling grouchy. And if they're really miserable, give them a dose of paracetamol or ibuprofen, and that will usually see them through the next 4 to 6 hours.
Thanks, Dr. Robbins. Really useful advice there. Another thing that was just going through my mind, I thought this would be a really good opportunity to just impress upon the importance of parents sort of taking their children to have their normal childhood vaccinations, because a normal childhood vaccination schedule includes things like haemophilus influenzae, and that protects children from developing more severe illness. I'm going to go to the next question is, and this is based on the fact that parents often have an expectation when they come to see you. Either they want reassurance or they want some medicine to try and make it go away. And that medicine often is antibiotics. So can you tell us about the place of antibiotics in the treatment of these illnesses, and why perhaps the majority of cases don't require any antibiotics at all, Dr. Robbins?
Thanks, Dr. Capazzi. It's a really good question. Most of these illnesses are caused by a particular sort of bug called a virus. Now, what we know is that viruses tend to run, certainly the viruses that cause coughs and colds, will tend to run their course over a period of a week or two, and then they go away without the need for any treatment, because our body's immune system, that's the infection fighting system, manages to get rid of them. It doesn't need any help to do that in most cases. And antibiotics do not work against viruses. So antibiotics have been developed to treat different sorts of infections that are caused by bacteria. It would be pretty unusual for a simple cough or cold to be caused by anything other than a virus. So if you treat it with antibiotics, the antibiotics have no effect. If your child has developed that second sickening, we call it, so sort of 7 to 10 days into the illness, they suddenly start to feel worse, that can be a sign that they've got a second infection on top of the virus, and that might need treatment with antibiotics. But in most cases, the cough or the cold is caused by a virus. It will go away with no treatment, and there's no need for antibiotics. They wouldn't do anything useful.
That's great, Dr. Rob. It's really useful to know that antibiotics in the vast majority of cases have no place at all. Only in a very unique circumstance do we need to use them. And it's always important to remember that antibiotics have their benefits in these cases, but there are side effects and risks of using antibiotics. So we've talked about lots of childhood illnesses. A lot of these illnesses in the respiratory tract present in a similar way, namely with a snotty nose, with a cough, with a wheeze or difficulty in breathing. Now, we've sort of reinforced the fact that most of these illnesses are within the normal spectrum. They'll get better, but there are certain symptoms that I just want to sort of address that where parents may need to actually look out for, which should prompt them to take their child to seek medical advice. What symptoms are those specifically, Dr. Robbins?
I think it's really useful to know what to look out for as a parent, and I suppose what your warning signs should be that maybe you do need to get an opinion from a healthcare professional. Now, what I'm going to talk about now is children who don't have underlying medical problems, children who weren't born very early and don't fall into the preterm or premature category, and children that don't have a history of serious heart or lung problems, because the rules may be slightly different for those children. But for most children, the signs that maybe you do need to seek some medical advice from some sort of healthcare professional would be if over the course of 3 or 4 or 5 feeds, they're taking less than half their usual amount. That can be a sign that they're using their mouth and their throat for breathing, and they're having to breathe so hard that they can't get enough fluids in, and that's a really good sign that you need to get an opinion from someone clinical at the GP surgery or speak to 111. If your child's taking more than half of the usual amount of feed or fluids, then generally they're doing okay. Now, it can be really hard to tell if your baby is best breastfed, how they're feeding, and so what you can use instead is looking at their nappies and how wet their nappies are. And in general, if the child is having wet nappies every few hours, they're getting in enough fluids, and that's a sign that their cough or cold isn't preventing them from feeding. You can use that nappy sign with children who aren't breastfed as well. It can be a really good way actually of reassuring yourself as a parent that they're doing okay. But if your child goes for 12 hours without a wet nappy or without having a wee in older children, that's a sign that maybe they're not getting enough fluids in, and you should be speaking to someone at your GP surgery or at NHS 111 if it's outside surgery hours. I think the other things that should prompt you to get some medical advice would be if your child doesn't look the right colour, if they're either very pale, if they're getting blue or mottled, you probably need to be phoning 999, okay? But if your child's pale and they just don't look their normal colour, you need to be speaking to a healthcare professional. If your child isn't handling as normal, so they feel a bit floppy or they feel a bit stiff and rigid, and that's, you know, something that isn't just in passing, that's something you notice over the course of, you know, more than a few moments, then you should be speaking to a healthcare professional, because that can be a sign that they're becoming more seriously ill. If you notice that their hands and feet are cold and you're inside, you're not outside in the cold, that can be a sign that they're becoming more poorly, and you should speak to a healthcare professional. But the main thing is to trust your instinct as a parent, and if your gut feeling is that your child really isn't well and you're worried, then again, speak to a healthcare professional, because you know your child better than anyone.
That's great, Dr. Robbins. Thank you very much for that. If we're just recapping those symptoms which should warrant a parent or guardian seeking medical advice. So just to reinforce, you know, we've had so much useful information through this webinar this evening. We've talked about coughs, cold, wheezes, how most children are generally quite well with it, how it's actually a normal part of the childhood journey to go through this. We've talked about those symptoms which certain conditions cause, such as bronchiolitis, a viral wheeze, croup. We've also talked about why antibiotics in the vast majority of cases aren't required. We've talked about how everybody within the healthcare community is doing their best to see patients, and why sometimes you might be signposted to other services. And I think it's been a really, really useful session for parents and guardians, I hope. In order to confirm that, we do need you to fill out your feedback forms. So there's a link with a feedback form. Please complete it. There are also other services running to reduce the pressure on the healthcare community. You've got some services funded by the NHS Department of Social Care and Health. Bernardus have got this fantastic initiative called BOLO, which is really providing a helpline advising on respiratory illnesses, focusing on supporting parents from Black, Asian and minority communities. It's a fantastic resource. I've had many parents that have used this and fed back really positively about it. You've got some other resources there too. This session is going to be posted on YouTube. Please tell us what you would like to hear as parents. Please spread the word of these webinars. We are hoping to do another webinar at some point in February. Thank you very much for attending the webinar this evening, and we will bring this session to a close. Good evening to everyone.